Air abrasion is a form of what we call micro-dentistry or minimally invasive dentistry. And when you think about a tooth, every time you replace a large filling, if it gets a little bit larger, it doesn't take too long before you're looking at a crown on a tooth. So if you can preserve good tooth structure right from the start and do minimally invasive dentistry, then you can prolong the life of teeth to the point there where hopefully back teeth never require crowns. And that's the philosophy behind minimally invasive dentistry. We've got a number of different means of doing it. So instead of the drill being the only means of preparing a tooth, it's like a carpenter that only has a hammer. All you got as a tool is a hammer, and all you see is nails. But we've got all the technologies to be able to do it. So we use the drill when we require it. We use air abrasion, which is very small, fine particles of aluminium oxide powder, which is used like a little, extremely precise mini sandblaster. We use that in conjunction with an air filtration device that picks up the dust that's being pushed around the place. And it's a very clean, tidy and painless way of doing preparations on teeth that are suitable for that, or for producing a tooth surface that's ideal to bond a filling to. So air abrasion is a nice needle-free way of doing things in the vast majority of cases. Other means of microdentistry we use are the laser as well. The laser can also be used for microdentistry. And the other one is healer zone, where instead of actually removing all the decay from the tooth, if the decay goes very close to the nerve of the tooth, we can remove the bulk of the decay and leave the decay that's closest to the nerve, that puts the nerve of the tooth at risk if you keep going, and treat the tooth with ozone, which sterilises the bacteria that's left in the decay process. And then you can place a normal filling material over that. And the tooth is actually more resistant to future decay after that's been used. So I like to be the first with new technologies that had the first healer zone unit in the country. Laser dentistry again is one of these forms of minimally invasive dentistry. There's a lot of different dental lasers around, but the laser which I concentrated on right from the start was what's called a dual purpose laser. So you can use it for hard tissues or you can use it for soft tissue. I'd have to say my most common use is soft tissues. So you're doing gum lifts and gum reshaping. So if you're doing a cosmetic realignment of gums, or people who have got a gummy smile, that they show too much gum and their teeth look quite short, then a little bit of careful sculpting of the gums with a laser is a beautiful way and with minimally invasive way again of treating it. The other older ways of doing the same sort of thing involves raising a whole flap of gum over the top of it, which is a very invasive procedure, grinding back the bone around it and then suturing it all back again. So you've got a long period of time of recuperation afterwards. With the laser, people go back after as soon as the numbness is gone. They're virtually unaware that anything's even happened. So it's a really neat and tidy way of doing a clean gum lift and putting your gum exactly where you want to put it. And that's the level where it stays. So it's beautiful to produce a really nice smile line, as well as the bottom of the teeth lining up. The gums are all lining up as well. So that's our most common use, I think, with a laser. It certainly can be used for fillings. I don't try to use it for fillings all the time. There are certain types of fillings for which it's ideal. Certain types of surgical procedures, we remove various different minor benign sort of growths from the mouth and subject them to microscopy, so they can be pathology results done on them. We do that with a laser quite frequently. The laser is a very useful tool. Couldn't live without my laser. We just had a 10-year-old child in here yesterday who came in for the first time with a really, really deep cavity and a tooth that we could see from the x-ray that this one was the decay was right down to the nerve of the tooth. And instead of removing all the decay, we remove as much of the decay as you're going to remove without deliberately exposing the nerve. And then you treat the tooth with ozone to sterilise it, and then we can place a filling material in the tooth there, or a sedative dressing material, which we did on this occasion yesterday. So we'll bring that child back in 4 months' time. The decay will be completely hardened by that time, and we'll be able to, and the nerves have a chance to shrink back away from it a little bit, and we can get in there and fill it properly. Whereas if we did it right from the start, then that child would have been up for either tooth removal or commencement of a root canal, which would be a real tragedy for a 10-year-old and a permanent tooth. A great saving of money for people, and a great saving of apprehension for children that don't have to go through those unpleasant type procedures like that. Something that could create bad memories about dental treatment in the past. Ozone's an extremely powerful antimicrobial agent. It kills absolutely everything. So viruses, bacteria, all sorts of nasty bugs that can influence people's mouths and faces. So ozone's a great piece of equipment to use. So we use it for treating decay. Quite often you can actually treat decay without even doing a filling on the tooth, as the tooth for some reason just does not continue to decay after it's been treated with the ozone. So it does something to the microbial film, the biofilm that's causing the problems, that it never recolonises as effectively afterwards. So ozone again is one of these